Are you taking medication daily? You might be silently destroying your leg strength. These aren't rare prescriptions. These are common medications millions take every single day. But here's what your doctor never told you. They could be making you weaker with every dose. Imagine this. You're standing up from your favorite chair. Your legs wobble. You reach for support. Was it just age or something hiding in your medicine cabinet? The truth is shocking. 3 everyday medications are secretly damaging seniors' mobility nationwide. The consequences? Devastating. Independence lost, confidence shattered, quality of life diminished. Most concerning? You might be taking one right now without realizing the damage happening below your waist. Studies show that leg strength declines 30% faster in people regularly taking these medications. Yet this critical information remains largely hidden from the public. Why? Because these are some of the most commonly recommended treatments by doctors across America. Today, I'm exposing the full truth about these leg-weakening culprits. The nighttime aid silently damaging your balance, the mineral supplement creating dangerous deficiencies, and the heart medication with a hidden cost to your mobility. Don't wait until you can't stand without help. Don't wait until a fall changes everything. In the next few minutes, I'll reveal exactly which medications are causing this damage, how they work, and what you can do to protect your independence before it's too late. Your future mobility depends on this information. Number 1. Sleep medications. Ever notice how your legs feel strange the morning after taking something to help you sleep? That subtle weakness isn't your imagination. It's the start of a dangerous cycle that threatens your mobility. Millions take sleep aids each night, not realizing they're trading tomorrow's strength for tonight's sleep. These medications change your brain chemistry to make you drowsy, but their effects last much longer than most people think, especially in older bodies that process substances more slowly. What makes sleep medications so concerning isn't just their immediate effects. It's how they build up in your system over time. The drowsiness doesn't fully go away between doses for many seniors. This creates ongoing mild impairment that affects muscle coordination and reaction time. Your brain signals travel just a bit slower to your legs, but that small delay matters when you need to catch yourself from falling. Studies show regular users have up to 40% slower muscle response, exactly what you need to prevent falls. The morning trip to the bathroom becomes more dangerous. Walking downstairs gets riskier. What starts as occasional unsteadiness slowly becomes constant weakness. Your body adjusts by taking shorter steps, moving less, and losing muscle faster from reduced activity. This creates a downward spiral. Weakness leads to less movement, causing more weakness, leading to stronger sleep medications to fight anxiety about mobility problems. Most worrying is how these effects look just like normal aging. When getting up from chairs slowly gets harder, it's easy to think it's just getting older, instead of connecting it to the pill taken hours before. This mistake means many seniors keep taking what's actually speeding up their decline. Doctors rarely make the connection either, often prescribing more medications for symptoms rather than addressing the real cause. The biological mechanism is especially alarming for adults over 65. Sleep medications don't simply wear off as claimed. They collect in fatty tissues, creating a reservoir of sedatives that slowly release into your bloodstream. This affects the neuromuscular junction, the vital connection between nerves and muscles that powers every step. The more often these medications are used, the worse the interference gets, until simple movements require conscious effort. The statistics show a troubling pattern. Long-term users of sleep aids have nearly twice as many serious falls as non-users. These aren't minor stumbles. They cause fractures, hospital stays, and permanent loss of independence. Even more alarming, this risk stays high for up to 48 hours after just one dose, creating constant increased danger for regular users. What's rarely mentioned is how these medications specifically weaken legs by disrupting deep sleep phases. Proper muscle recovery needs those deepest sleep cycles, exactly what these medications artificially change. While you might feel you've slept all night, that sleep lacks the restorative quality your muscles need. Night after night, this deficit grows, showing up as weakness, especially in the large leg muscles that support your body weight. Beyond physical effects, there's the psychological impact. As balance confidence drops, fear of falling rises. This creates tension in how you move, further hurting natural walking and balance. Activities once enjoyed without thinking, neighborhood walks, shopping trips, visiting friends, become sources of worry. This withdrawal from activity speeds up both physical decline and social isolation, greatly reducing quality of life. The solution isn't throwing away your sleep medication tonight. Stopping suddenly can cause worse insomnia than before. Instead, work with a healthcare provider who knows geriatric medicine to create a gradual reduction plan. At the same time, use proven non-drug sleep strategies, consistent sleep-wake times, less evening light, optimal bedroom temperature, and relaxation techniques that work for older adults. Many find cognitive behavioral therapy for insomnia, CBTI, works well without the dangerous mobility side effects. Most importantly, during this transition, do gentle strength exercises targeting the leg muscles most affected by these medications. Even simple chair rises, done regularly, can start rebuilding lost strength. Your body has remarkable ability to recover. Given the right conditions, strength returns, balance improves, and confidence with it. Your independence doesn't have to be sacrificed for sleep. With the right approach, you can have both for years to come. Number 2. Excessive zinc supplements. That bottle of zinc supplements in your medicine cabinet, the one promising immune support and faster healing, might be the unexpected culprit behind your worsening mobility. Many health-conscious seniors faithfully take zinc supplements thinking they're boosting their defenses, not knowing the seemingly helpful mineral could be weakening their foundation. What starts as a good health habit slowly turns into a hidden threat to independence when the careful balance of minerals in your body gets disrupted. The problem isn't zinc itself. This essential mineral is crucial for immune function, protein synthesis, and wound healing. The danger comes when supplementation exceeds what your body needs, creating imbalances that affect multiple biological systems. Most concerning is how excess zinc interferes with copper absorption, causing a secondary deficiency with serious effects on neuromuscular function. This zinc-copper relationship is one of the most overlooked yet potentially harmful nutritional interactions affecting mobility in older adults. When zinc levels go above 40 milligrams daily, an amount easily reached through combined use of multivitamins, immune boosters, and dedicated zinc products, copper becomes harder for your body to absorb and use. This mineral conflict happens in your digestive tract, where high amounts of zinc block copper from entering your bloodstream. As copper levels slowly drop, a process begins that directly affects how well your nerves communicate with your leg muscles. This disruption isn't obvious at first, but builds silently over months of supplementation. The link between copper deficiency and leg weakness involves its role in forming myelin, the protective coating around nerve fibers that allows efficient electrical impulse transmission. Without enough copper, myelin production becomes compromised, leading to gradual deterioration of the peripheral nerves controlling your legs. Each step becomes less certain, each movement needs more focus, and the distance you can walk comfortably slowly decreases. What is especially tricky is how these changes look like normal aging, making it hard to find the true cause without specific testing. By the time symptoms become impossible to ignore, significant nerve damage may have already happened. The initial tingling or numbness in your feet slowly moves upward, affecting the precise muscle coordination needed for stable walking. At the same time, copper deficiency harms collagen formation, weakening connective tissues throughout your legs. from tendons and ligaments to the support structure for blood vessels. This double attack on both nerve transmission and structural integrity creates perfect conditions for mobility decline. What makes this situation particularly dangerous is how the initial supplementation often starts with positive results. Many feel more energetic or get fewer colds when first taking zinc, strengthening the belief that more must be better. This immediate benefit hides the gradual onset of deficiency symptoms developing underneath. The time between starting excessive supplementation and noticing leg weakness can be months or even years, making the connection hard to spot without specialized knowledge. Research findings on this topic show an alarming pattern. Studies examining long-term zinc supplementation without copper co-supplementation show up to a 78% increased risk of mobility-limiting neuropathy compared to non-supplementing groups. Even more concerning, once peripheral neuropathy develops, simply fixing the imbalance doesn't guarantee full recovery. Nerve damage can continue long after mineral levels normalize, highlighting the critical importance of prevention rather than treatment. Beyond direct neuromuscular impacts, excess zinc creates additional barriers to maintaining leg strength through exercise. The fatigue from copper deficiency makes physical activity increasingly difficult, reducing participation in the very movements that could help preserve muscle mass. This worsens the problem, speeding up the transition from occasional unsteadiness to consistent mobility limitations that compromise independence and quality of life. Perhaps most troubling is how few healthcare providers think to check supplement use when evaluating unexplained weakness or balance issues. Standard neurological tests rarely include checking for mineral imbalances unless specifically requested. This oversight means countless seniors continue taking zinc while unknowingly undermining the very independence they're trying to maintain through health-conscious choices. The solution isn't eliminating zinc entirely. This essential nutrient remains vital for numerous biological functions. Instead, implementing specific strategies can help maintain the critical balance needed for optimal neuromuscular health. First, list all supplements containing zinc, calculating your total daily intake from all sources. Aim to keep total supplemental zinc below 25 milligrams daily, as research shows this level rarely triggers copper deficiency while still supporting immune function. Second, consider supplements that combine zinc with copper in the appropriate ratio, usually 10:1, to prevent imbalance. Finally, prioritize getting minerals from food sources when possible. Natural foods contain balanced profiles of complementary nutrients that work together rather than against each other. For those already experiencing symptoms of copper deficiency, specialized testing can confirm the diagnosis, allowing for targeted treatment rather than continued supplementation that makes the problem worse. With proper mineral rebalancing and targeted exercises to strengthen affected muscles, many see significant improvement in leg strength and stability, regaining confidence in movement and preserving the independence that defines quality of life in later years. Number 3. Statin medications. You've been diligently taking your prescribed cholesterol medication, faithfully following doctor's orders to protect your heart. Each small pill represents your commitment to cardiovascular health. Yet something doesn't feel right. The stairs seem steeper. Standing requires more effort. Walking distances that once felt effortless now leave your legs unexpectedly fatigued. These subtle changes might not be age catching up with you. They could be directly connected to those heart-protecting medications. Statins, the most widely prescribed cholesterol-lowering drugs worldwide, operate through a biochemical mechanism that extends beyond their intended target. While effectively reducing cholesterol production in the liver, they simultaneously block the synthesis of other critical compounds your muscles depend on for optimal function. This creates a physiological trade-off rarely discussed during prescription conversations. Heart protection, potentially at the expense of muscle strength. The biological pathways affected disproportionately impact the large, weight-bearing muscles of your legs that determine your mobility and independence. The muscle weakness associated with statins manifests differently from typical age-related decline. Rather than gradual, symmetrical changes, statin-induced myopathy often presents asymmetrically, affecting one leg more severely than the other. This creates subtle gait imbalances that progressively alter walking mechanics, placing abnormal stress on joints and accelerating wear patterns. Your body instinctively compensates by reducing activity, further diminishing muscle mass through disuse. This cascade effect transforms what began as a biochemical disruption into a structural and functional decline that compounds monthly. Most dismiss early warning signs, mild discomfort after exertion, unusual fatigue climbing stairs, or morning stiffness lasting longer than normal, as inevitable aspects of aging rather than medication effects. This misattribution leads many to continue their statin regimen unchanged while reducing physical activities, creating perfect conditions for accelerated strength loss that eventually compromises independence. Research examining muscle biopsy samples from long-term statin users shows significant alterations in muscle fiber composition. Particularly concerning is the disproportionate reduction in type 2 fast-twitch fibers, precisely the muscle fibers responsible for generating rapid power when needed to prevent falls. This explains why some statin users report feeling generally stable during regular movement, but experience sudden leg weakness during moments requiring quick stabilization. The biochemical mechanism behind this effect centers on CoQ10, coenzyme Q10, a critical compound that facilitates energy production within muscle cells. The same enzyme pathway statins block to reduce cholesterol also reduces CoQ10 production, creating an energy deficit within muscle tissue. This deficit becomes most apparent in metabolically active muscles that demand continuous energy production, exactly the profile of your leg muscles during walking and daily activities. As CoQ10 levels decline, muscle cells struggle to meet energy demands, resulting in progressive weakness and sometimes microscopic damage to muscle fibers. Environmental factors can significantly amplify these effects. Physical exertion, temperature extremes, or concurrent use of certain medications can suddenly intensify muscle weakness that previously seemed manageable. This variability often confuses both patients and healthcare providers, making the connection to statin use difficult to identify. The risk-benefit calculation becomes particularly nuanced for adults over 70. While statins provide demonstrable cardiovascular protection for those with established heart disease, their preventive value for healthy older adults remains controversial. Meanwhile, preserving leg strength represents a fundamental determinant of continued independence and quality of life. Genetics plays a significant role in determining your individual susceptibility to statin-induced muscle effects. Variations in specific genes responsible for statin metabolism and muscle cell energy production create dramatic differences in how people respond to identical dosages. This genetic component explains why some individuals experience significant leg weakness on even low-dose statins, while others tolerate maximum doses without noticeable effects. Research consistently demonstrates that muscle effects increase proportionally with statin potency and dosage. High-potency statins carry greater risk than moderate-potency options, especially at maximum dosages. This creates potential opportunity for optimization, finding the minimum effective dose, or switching to a lower-potency statin that still achieves cholesterol targets while minimizing impact on muscle function. The solution isn't necessarily discontinuing statin therapy, particularly for those with established cardiovascular disease. Instead, implementing targeted strategies can help preserve leg strength while maintaining heart protection. Supplementing with CoQ10, 200 to 300 milligrams daily, directly addresses the biochemical deficit created by statins. Equally important is incorporating specific resistance exercises targeting the leg muscles most affected by statin use. Progressive resistance training twice weekly has been shown to counteract statin-induced changes in muscle biochemistry. For those experiencing significant leg weakness despite these interventions, Discussing medication alternatives with your healthcare provider becomes essential. Finding the optimal approach means balancing cardiovascular protection with preservation of the leg strength that maintains your independence. Don't let these medications silently steal your independence. Take control of your leg strength today. If this video opened your eyes to hidden threats, smash that like button and subscribe now. Your future mobility might depend on the information you've just discovered. Turn on notifications so you never miss our life-changing health alerts. Share this video with someone you care about. It could be the difference between years of independence or dependency. Your action today determines your mobility tomorrow. Subscribe now.